On this episode, I sit down with Dr. Robert Pearl, who talks all about the risks and liabilities that are inherent within generative AI as healthcare moves forward with this new technology. It's all right here, right now, on this episode of Red Hot Healthcare. Let's go.
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hi, everyone. This is Steve Ambrose, and welcome aboard. On today's show, we're joined by Dr. Robert Pearl. Dr. Pearl is the former CEO of the Permanente Group, where he was responsible for over 10,000 physicians, more than 40,000 dedicated staff members, and they contributed to the care of over 5 million patients nationwide. Named one of modern healthcare's 50 most influential physician leaders, Dr. Pearl's the author of Mistreated: Why We Think We're Getting Good Healthcare and Why We're Usually Wrong, a Washington Post bestseller. You can catch Dr. Pearl on his show, the Fixing Healthcare podcast. And he's also a well-followed contributor to Forbes magazine, where he shares many forward-thinking views, including on generative AI. Dr. Pearl, it's a privilege and pleasure to have you with us today on Red Hot Healthcare. Thanks for making the time.
Steve, it's my pleasure to be on the show today. Please call me Robbie. And for your listeners, they should know that all profits from my 2 books go to Doctors Without Borders, a wonderful charity that's worth supporting for global health.
Robbie, you've been an outspoken advocate really for generative AI from almost from the start, and in particular, ChatGPT for the potential value add it has in healthcare. On a high level, I'd like to know what you see as some of the most transformational changes and benefits that generative AI can bring to healthcare in years to come.
Steve, I don't know if you've used GPT-4 or one of the other new generative AI tools from Microsoft or Google, but they're all amazing. You can interact with the application as though it's a person and receive responses that feel very human. So let me start by pointing out that outside of administrative and bureaucratic tasks, ones like writing letters to insurance companies, the current applications, they're not ready for independent clinical use, but they're getting close. Here are 4 examples of what will be possible in the near future. And by the near future, Steve, I mean at most 5 years. Remember, at the rate that the tools are becoming more powerful, what's available today will be 30 times better by 5 years from now than what currently exists. First, it will help physicians make better diagnoses. Already, generative AI has been shown to be as good or even better than most clinicians at taking extensive medical information and making an accurate diagnosis and recommending the best treatment. Second, it will help patients with lifestyle medicine. Already they can create menus in any language based on their medical needs, along with shopping lists and cooking instructions. They can provide and monitor exercise programs, and physicians can use them to provide information on a range of diseases and modify the text based on the patient's level of knowledge. Third, it will serve as a doctor's assistant in the patient's home, answering medical questions, reminding people to get their preventive testing, helping them arrange transportation, and finally, it can be connected, and it will be connected in the future, to medical devices like glucometers and electronic blood pressure cuffs, and facilitate daily management of chronic disease, and be used as part of a hospital at home program. You know, Steve, today, ChatGPT is just a toy, but in the future, it'll be essential and as essential to medical practice as the stethoscope has been for doctors for the past centuries.
When ChatGPT first came out, of course, it was tremendous and and it hit healthcare just, I mean, with a tremendous impact. One of the things that came out right away was the comparison around how human doctors and generative AI engagement might contrast when it comes to empathy. You've had a recent piece in Forbes comparing doctors and generative AI specifically on the way empathetic communication is delivered to patients. What's been some of the latest thinking and research in this particular area?
The study you've referenced is about questions that doctors received. This was through Reddit, and the answers they gave. And then the researchers took the exact same questions and gave it to generative AI to provide its responses. What they found is that in 80% of the cases, the generative AI application was superior in accuracy and in clarity, and as you mentioned, maybe most importantly, in empathy. The explanations for why this machine can be better than a human has been diverse and, as you know, intense in social media. One reason that doctors didn't do as well was the lack of time that they have, given the hecticness of medical practice today. A second reason is that as humans, we confuse feeling empathetic with the ability to express it. We often think we're empathetic because that's how we feel, but we don't tell the patients and don't show it to our patients. It's possible that clinicians felt very empathetic, but as I said, the patients were not able to recognize it. And it's likely the chat box, they didn't feel it. It didn't feel anything. I'll say they, but that's humanizing it. But it had learned what an empathetic response was and what people wanted and needed to hear. And of course, it's possible that in the culture of medicine, after a decade of 80-hour work weeks, that the empathy that drove people to apply to medical school had been sucked out of them. But what was clear was that patients weren't getting in this study what they wanted, and they actually preferred generative AI, ChatGPT. I personally think, Steve, that the results are a clarion call to figure out how to give physicians the time they need, both to be empathetic and expressive. And that's where I'm optimistic that generative AI can be of great assistance. Doctors, particularly in primary care, they're spending hours on tasks that machines can do. And if they had 2 or 3 more hours a day, they could meet patients' needs far better than today. Without question, by 5 years from now, both humans and IT will be essential for optimal medical practice. I think what's being debated are the specific roles for each. And I believe that clinicians today are underestimating what future generations of generative AI will be able to do effectively and safely.
So, what happens when AI gets things wrong in healthcare? And by that I mean the potential for errors, injuries, liability related to output that's inaccurate or training data that is the foundation for the generative AI tool that's being used, perhaps having errors. And I'd like to kick this particular question off, if I could, with AI-driven chatbots. And their use, as you know, is rising, especially with the influx of consumerism in healthcare and competition that's coming in from the retail side with new entrants in healthcare. So what are your thoughts on the potential risks and negative impact related to bringing in chatbots on the front end or the digital end of care, and then once a patient's in care, regularly touching base with it?
Steve, let me repeat for listeners what I said earlier. What exists today in generative AI, it's not ready for clinical practice without direct clinician oversight. So we're not talking about what's been here really only for 8 months. We're talking about the next couple of years. But to your question, it would be the equivalent of asking a third-year medical student to do a surgical procedure or care for a patient in the ICU. We just wouldn't do that without proper supervision. That's where we are today. But like the student, I believe generative AI will become smarter and more reliable year by year and at a very rapid pace. You may remember Moore's Law that said that every 2 years, computers would become twice as effective, twice as powerful, twice as fast. We're seeing that happen in generative AI every year, not even every 2 years. Relative to the shortcomings, the data that's available today, it's only accurate through 2021. That's when it was last uploaded, or the vernacular of generative AI, pre-trained. And we know the technology will, when pushed, hallucinate, meaning that it will make up answers that aren't accurate. But Steve, given the quality of the engineers updating the systems, and given the massive amount of resources of OpenAI, Google, and Microsoft, these problems will be solved in the near future. More data will be loaded, and they'll figure out how to avoid the hallucinations. We can expect that to happen. Not today, but sometime soon. And of course, as with search engines and other online tools, there are questions that we have to address about privacy and security. But there's nothing about this technology from a negative, problematic side that's more dangerous than what currently exists. Remember, even before ChatGPT, people so-called Google diseases, and we know that they read inaccurate information online. Just look at the vaccine misinformation that was there. And of course, they've had privacy compromised. If you type in something about Google diapers or to order it on Amazon, you'll get a range of ads for baby formula and newborn photos. The machines and the technology are constantly what's called scraping information and making assumptions based upon the searches that you do. To me, the issue isn't generative AI and ChatGPT. It's just the nature of computers and the internet today. Data will be scraped for financial gain from whoever and whatever tools are used. Although, as Zoom recently found out, you may have seen it last week, users are becoming more protective of their data. And I can imagine Congress passing restrictions that will impact generative AI, ChatGPT, and the other tools.
Even though Google and other websites on a search might have erroneous information, that information is on a web page that they could look at, that they can review. With generative AI being behind these chatbots, they're real, and all the billions of combinations of words and phrases and topics that could go into it. As you said, sometimes the generative AI is going to push out something that might not make sense. But if the chatbot is on the website of a hospital or health system or a insurance company, a health payer, then perhaps there is a risk and a liability with having a chatbot on a company website today, a healthcare company's website. What do you think?
If the chatbot is providing medical information today on the generative AI tools that exist, I think that's inappropriate, and I'm not aware of people who are doing that. I am aware that people are using generative AI as a communication tool, a prompt tool, which again is not dissimilar to the type of approaches that have been used with the technology that existed prior to generative AI. I'll go back to the fact that this is not the version that should be used. Having said that, I also want to point out that there are human errors that occur when information is provided. And we need to measure the performance of a generative AI against the performance of humans. If I gave you the following thought experiment, Steve, I'm going to tell you that there's a switch that I can pull, that tomorrow every car that exists in the United States today is going to be a self-driving car. It's not going to have a steering wheel. It's not going to have a brake pedal. It's not going to have a gas pedal. And I tell you that at the end of the experiment, after 1 year, 10,000 people died as a result of an error by a self-driving car, what would you say? Would you call that a success, or would you call that a massive failure? And I think most Americans would say 10,000 deaths from self-driving cars, that's terrible. And yet 50,000 people die in auto accidents today. That's an 80% improvement. There are not a whole lot of things we do in medicine that have an 80% improvement. That's our bias as humans about this technology or technology itself. I think that's what we need to be looking at. How often are misdiagnoses, medical errors made, avoidable problems with lethal consequences today that the generative AI technology will improve? How often do people have problems because they can't access medical information or medical care? And I am confident that in the near future, not today, it will be better. And remember, how people interpret it has to be factored in. And when I put all the pieces together, my prediction is that individuals using a chat bot in the future will actually get far better outcomes. And we can talk about that some more as to why that they are able to get if it doesn't exist.
Right, but you don't disagree that there's going to be mistakes. That even with all of that being said, that there is a very real possibility when you're talking about, let's say, millions upon tens of millions of interactions with generative AI, and probably maybe more than that each year, that there's the possibility that mistakes can be made in, involving somebody's care or decisions around care after getting those answers.
Let's look at what's happening today with humans. We have 200,000 at least deaths every year from medical error, preventable medical error. It's been estimated there's at least as many failed diagnoses. I'll go back to this question of what's the baseline? What are we going to compare it to? Will it make mistakes? Absolutely. And as you may have read from some of the stuff I've written in the past, I've been very critical of companies like Apple that have been unwilling to create these products for exactly the reason you're saying. Because if we're 99.99% accurate, when you have sufficient number of people using any tool, any application, there will be mistakes. But if that outcome is going to be not 10 times better, 100 times better, 1,000 times better, but just not perfect, I just believe that we need to see generative AI not as this alien technology dropping into our world, but as being part of the reality of medical care, that problems do occasionally occur, and we need to understand how and why, and then compare it to what otherwise would have happened and measure the improved clinical outcomes. I really believe that in accomplishing this, particularly given today's dysfunctional healthcare system, that we're just going to see far better outcomes in the future than today, with future generations being implemented, developed, and pre-trained.
Let me just move on to something you mentioned before, and that is bias. Generative AI systems, as we know, use underlying algorithms, Robbie, that analyze vast data sets to learn all about the patterns, the relationships with the data. But we know that bias, and some would call it discrimination, are really growing challenges in creating these algorithms. So I'd like to know, how you would weigh and prioritize the benefit from generative AI and balance that out with the very real likelihood of bias within the underlying algorithms.
Steve, I find a lot of the focus on bias relative to generative AI to be a bit bizarre. And what I mean by that is that the bias in technology doesn't come from the technology itself. There is no bias in generative AI. Where the bias is the information preloaded, pre-trained that comes from humans and then is reflected in the AI. You've seen multiple articles, one recently published in England Journal of Medicine, that when you take a hypothetical clinical decision for a complex patient, and all you do is change the race of the patient from white to black in the narrative that's given to clinicians, that they recommend higher quality medical care for white patients, even though the description of the medical problems are identical. When you look at actual practice, what we see is that physicians recommend sophisticated cardiology evaluations for patients coming to the ER presenting with borderline heart problems and potential heart attacks than they do for black patients, even though both have identical insurance. You could almost say that rather than putting a warning sign onto the technology, we should put it onto every ER entrance in the United States today, because that is where bias occurs. And again, when it comes to humans, we often overlook it or dismiss it or minimize it. When it comes to the technology, then we want to highlight it. The bias is not in the technology. It's just reflecting what doctors do. It's just mirrored in clinician performance. And this is where I'm actually optimistic, Steve. I think that generative AI can be less biased than doctors. Remember, this bias we're talking about, it's not conscious, it's not discrimination, it's implicit bias. We're blind to it. We do it without recognizing what's happening. The literature is vast around that, and unless you take an implicit bias test, you won't see it. But unbiased technology can point it out and bring it to human consciousness. I think it's a great area of opportunity for the future.
It's interesting, your answer, Robbie, because are we going to get to a point eventually where AI is going to be checking and writing and improving upon the algorithms or its own algorithms where, maybe humans do have those flaws?
That is an intrinsic ability that artificial intelligence has, to be able to learn as it moves along. All you have to do is go back to the literature when AI was used around the game called Go, a very complex game that no one ever thought a computer could beat a human at. Chess is a relatively simple game compared to Go, and it was able to do that. And what was most interesting is that it accomplished it not by studying games that humans played. It did it by actually challenging itself and repeating games against itself. And it created moves that humans had never thought about. I can imagine a time, again, not the current generative AI, when video, which is already being embedded in generative AI, will watch doctors and nurses. And they'll look at the care provided in the hospital and the 200,000 deaths a year from preventable medical errors. The technology will say, stop, you didn't do something right. We know the steps that can improve it. We know hospitals that have been able to lower the number of patients developing pneumonia in ICUs or patients having medication errors. We know how to accomplish it. We just skip the steps as humans thinking it will be okay. It's a bias that we have as we're rushed. And I think generative AI could stop. All of this is pretty straightforward for an artificial intelligence tool. We just haven't had the right tool up to now. I've been a critic, actually, of AI, and I felt that it overpromised because it was this narrow AI and the amount of information that would need to be put into it, or the fact that the electronic health record is often going to be copy, paste, copy, paste, copy, paste, even when it's not accurate. Generative AI can go into the data source, I'll say in quotes, on its own, find all this information, and as you point out, be able to learn at a rate faster than people and actually teach clinicians how to provide care. This is not the next 1 or 2 years, but I think it's going to happen in the next 10 or 20.
One of the biggest concerns around generative AI has been data privacy and people getting at confidential patient data. For example, the AI system that's generating outputs could be tapped into and engineered to reveal sensitive data from hackers and the like. What are some of your top thoughts around data privacy and generative AI?
Let me first start by saying that patient privacy is vital, but I don't see that the risks of generative AI being any different than any other EHR system or any other internet tool. The risk of someone coming in and hacking into a system exists every time we're using the internet. It doesn't matter what we're using it for. The stories abound of people having their privacy impacted, their credit minimized, decreased, destroyed. We're looking at people whose bank accounts have been hacked into. What's interesting is that most of the time it happens by an error of a human, not the technology itself. You see a password that's shared or a link that's clicked on inappropriately. And I think it's a massive issue, but it's not in any way that I can see specific to generative AI. In fact, since generative AI is taken from information that right now, at least, is broadly available on the internet, I don't think people would go into generative AI to get that underlying data. What they will be very interested in is how are people using it? And they will be looking at this question. Now, again, what's fascinating to me is how much of the generative AI systems have actually come off social media tools. So again, it's not that this problem is not huge, threatening, dangerous. It's just that I don't see any way that the introduction of generative AI is going to make it any worse than it currently is. Your medical information exists in an EHR. Today, the internet information can be scraped off of a variety of websites. Social media is already accomplishing this. TikTok, it's a great worry relative to international diplomacy. We have all these issues today, Steve. I don't see generative AI making it any worse.
Is there a possibility that doctors, nurses, and even the admin side of provider organizations can eventually become too reliant on generative AI to the point where maybe they missed these subtle nuances and they make mistakes because they're over reliant on the technology in their own practice?
There's no question that as we become reliant on technology, we risk losing expertise. I mentioned earlier about GPS. I suspect that I don't remember as well how to go from one place to another as I would have without it. Spell check and calculators make it less likely we'll be accurate in spelling and math. This is the nature of progress. I mean, just ask yourself, is there any question that the introduction of CT, MRI, and ultrasound haven't led to a decline in the ability of doctors to do a physical exam? Are they going to miss signs? Of course they are today, but is there any question that without these tools, that more diagnoses would be missed than ones that are made? Clinical outcomes would be poorer. This is by definition, every time humanity makes an advance, we give up something from the past. But that doesn't mean we should ban these tools or devices. I think what we need to do is to become dramatically better at the things that only humans can do, and then use technology to free us up to be able to apply our unique expertise. I'll go back to what I said earlier. Today, clinicians make lots of mistakes, and they fail to follow evidence-based approaches. And the combination kills hundreds of thousands, maybe as many as 500,000 people annually. And when I net it all together, I think we'll save 9 lives for every one that might otherwise be lost. But I think that higher quality will only happen if, as clinicians, we lead the way. We figure out the ways to maximize, not limit the technology. And I worry that the culture of medicine and human bias will stand in the way. Across history, there are dozens of stories of doctors getting in the way of progress, from failing to wash their hands despite the amazing work of Ignaz Semmelweis, opposing Medicare in the 1960s, to denigrating efforts at the start of this century, ones around patient safety, calling it cookbook medicine, believing that we don't need to do it, when again, errors and mistakes were being made in the operating room and the hospital environs. Yes, I think we're going to give something up, but again, we're going to get far more in return.
We talk about healthcare being more patient-centric today than it's ever been, and the need to keep driving that patient centricity, particularly with whole health and care contextualization. How should patients be informed when generative AI is being used as a tool within their care and treatment? And do you think that the notification, Robbie, should extend from the clinical environment to also include the admin and financial interactions that they might have where AI might be involved as well?
Steve, actually, I think in the near future, patients will need to be informed when doctors refuse to use AI, not when they're using it.
Hmm.
I don't need to know when the pilot of my plane is using technology, but I definitely want to know when the pilot is refusing to use it and turns off the systems so I can get off of that plane. On the other hand, if an application isn't going to include a clinician as part of the process, then the patient should know today that the recommendations are solely those of an AI application. So I want to differentiate today from the future. But I would hope that every doctor in the future who isn't sure about a diagnosis or treatment would avail him or herself of the technology. Probably at the start of your career when you were stumped, you would go to the library for information. Now you probably use your iPhone and Google search to find the information. Soon people will rely on generative AI. It's far superior to any of the tools that currently exist. And remember that medical information, Steve, is now doubling every 72 days. It's just not possible for people to keep up. I'll go back to what I said. I think if we're not going to use AI, generative AI, we should tell patients that. And if I were a patient and my physician were refusing to make it available both to him or herself when they were stumped, or to me when there was a way it could assist my care, that's what I'd want to know. I'd probably look for another physician. When it comes to the other purposes you mentioned, besides direct patient care, I think it's important to know that it's happening, it's being used, but I think that's true for every computer and internet function. I think people assume today that when computers are involved, that AI is likely to be applied, but I would favor greater stringency and rules and regulations around that use, particularly when it comes to financial consequences, because I have less confidence that the tools will be used for the benefit of patients, whereas I do have a confidence in clinicians that they'll use what will become available, generative AI, ChatGPT, for the medical care that has been the mark of medicine for 5 millennia.
Getting into generative AI, we've been talking about clinical care and patients interacting and clinicians interacting. How do you see generative AI and its rise changing the relationships that providers have with payers, especially in value-based care models?
Steve, I'm a big believer that with the technology that's currently available, we can provide simultaneously superior medical care, convenient access, and greater affordability. And that to me is the essence, the definition of value-based care. I don't believe that much of what is called value-based care today in the United States fills that bill. I see generative AI integrating both with a comprehensive EHR and skilled leadership that then will allow us to be able to provide better care, to monitor patients with chronic disease, not on a calendar basis, but every day from inside their homes. In the interim, I think generative AI will be used by insurers to deny care. They're already doing it. We've seen this. And of course, it will be used, and we're reading about this in social media, clinicians using it to get around these attempts to limit restrictions on care delivery. This battle, to me, Steve, between clinicians and insurers, I see it as an anachronism left over from the last century. It's a relic of fee-for-service that stands in the way of health in this country. Physician judgment, I think, will always be important. And I think that generative AI in the future will serve as a powerful way to make that judgment, that decision-making process better and better. In terms of where the relationship is going to be, I think it has to move from being what today is a vicious cycle to a virtuous cycle. It needs to be synchronous. It needs to be maximizing both. And I see a shift in the underlying economics and the evolution of technology and putting on top development of leadership as the tools that are going to be necessary. You and I both know the American healthcare system today is struggling. It's failing to deliver the value, it's failing to deliver the outcomes that's needed. It requires transformation, and I don't see transformation happening unless we're willing to embrace the technology that's available. And generative AI, to me, will be as vital. As we said earlier, the stethoscope, the Gutenberg printing press, the internet, the computer, all of the pieces that have made modern society able to provide so much more to people than it could in the past. As you can tell, I'm quite optimistic, although I am cautious to point out one last time, it's not what we have today. What we have today has only been here for 8 months. It's what's going to happen 2, 3, 4 generations into the future, and that will occur over the next 3 to 5 to at most 10 years.
Dr. Robert Pearl, I want to thank you so much for the time that you've taken to stop in and give us your insights. Just very informative, and I appreciate all your thoughts around generative AI. Looking forward to talking about this and other subjects soon.
Steve, thank you so much. It's been a privilege and a pleasure to be here. I appreciate very much you making the audience aware both of the positive power of new technology and the risks that we need to minimize going forward.
And for our listeners, don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned to Red Hot Healthcare for more shows covering the healthcare topics and challenges that you care about. For more information on this and other shows with great leaders, please visit redhothealthcare.com. I'm Steve Ambrose. Have a great rest of your day.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.